Okay, here we are. This is Miss Catlin again. I'm going to go over key points for drugs and herbal therapies that you will find in between Chapter 4 and Chapter 6. This is not a bad section, but I have heard some people say there's quite a few questions on NCLEX. Depends on how you look at it. There's not that many actually on your Kaplan that I can find related to herbs. It's something that more and more people are doing, and you have to be very aware. So here we go. Drug interactions. When altered or modified action or effect of a drug is a result of an interaction with one or multiple drugs. I mean, that's a self-explanatory. Adverse reaction is an undesirable effect that ranges from mild to untoward to severe, including hypersensitivity reaction and anaphylaxis. Sometimes the reaction of the two medications together can cause one to have increased adverse reaction. Incompatibility is the chemicals or physical reaction that occurs among two or more drugs. In vitro. In vitro meaning like in a lab or somewhere, and I think here referring to incompatible medications, like when you're drawing them up. And if you haven't done it yet, that's one of the other things you will possibly do. So many things now are coming more and more specifically dosed from pharmacy, so you may not do it as much as we used to do it. But you will draw something up in a syringe, and you'll pull up with something that you can only put with water, sterile water, and you pull it up with saline, and then it turns into this rock, and that's a in vitro drug incompatibility. Okay, pharmacokinetics. It's why I put these chapters together, because there's some things that we just covered. Remember, pharmacokinetics is that add, meet, absorb, distribute, metabolize, excrete. And pharmacodynamics is the actual action of the drug itself. Additive drug effect, synergistic drug effect, or potentiation. This is in relation, this is in relation to drug interactions. So the pharmacodynamics of an interaction of drugs has the same thing where you're looking at the ADME or pharmacokinetics and the pharmacodynamics. Does one potentiate the effects of other? Synergistic drug effect or potentiation make one drug might be given with another because it potentiates or makes that drug more effective. Antagonist, you might give a drug because an interaction, you want the interaction of an antagonist, so they have too much, they're bleeding, their heparin levels too high, and you're giving something to reverse that effect, or giving some charcoal something to cause them to vomit, do something to interact with whatever it is that they took. There are several tables in your book. Table 4.1, enzyme inducers and enzyme inhibitors. It's not that I want you memorizing it, you just need to be familiar with an inducer and inhibitor, what they are, why you would want that to happen. Your table 4.2, pharmacokinetic interaction of drugs. This is one of those ones, if you think about it, like in your table, and they have absorption, and the drug is a laxative. It speeds the gastric emptying. So if you take a laxative, that makes the mucosa in the intestines relax, and it makes things go through faster. You may not have time for some certain medications to absorb. Let's see. Distribution, anticoagulant competes for protein binding sites. If you give more than an anticoagulant and anti-inflammatory together. What else? Excretion, decreasing the antiarrhythmic quinidine decreases renal excretion of another drug such as digoxin. Just looking through, kind of getting an idea what they're talking about on pharmacokinetic interactions, how different drugs coming in combination with each other affect these things. For table 4.3, drug interaction with anticoagulants and prescription drugs. We'll get into a little more. We'll get into anticoagulants later. Food is a big factor with anticoagulants, more so than medications. A biggie here in table 4.3 is your aspirin, because aspirin increases your bleeding, and if you're on an anticoagulant, that can make that worse. What's another one? Trying to think of something that's really, really common. Yes, here we go down to vitamin K, decreased effects of anticoagulants. So people that are on Coumadin, to try to decrease their chance of blood clots, will have to be very careful with taking an over-the-counter anything that has a vitamin K in it. Table 4.4 on page 34, pharmacodynamic interactions of drugs. Those are the additive. It's in the same drug category. The drug effect is the sum of both drug effects. So it has an additive. It doesn't make one more than the other, but whatever this drug's doing and that drug's doing, they each have their normal effects added to each other. 1 + 1 = 2. Synergistic is one that potentiates. It increases or enhances the effect of one drug greater than it would be if you didn't take the other drug with it. Antagonist, two drugs in opposing drug categories cancel the effects of both drugs. That's when you want to do, like if they overdosed, or you need to reverse the effects quickly, such as for, okay, here we go. I didn't even realize I had this slide. Addition, 1 + 1 = 2, and the synergism, 1 + 1 = 3, greater than the sum of the individual. Potentiation, one drug a drug which has no effect enhances the effect of a second drug. Antagonism, they block each other out. One inhibits the effect of the other. Incompatibility, two drugs mixed in a syringe result in a chemical reaction, and neither drug can be used, which is something I mentioned. Unfortunately, you'll probably have the experience of doing. I keep talking about the antagonism. Protamine sulfate is what you will give to reverse the effects of heparin, and vitamin K is what you give to reverse the effects of Coumadin. Okay. Drug interactions. There are drug-food interactions. Food is known to increase, decrease, or delay drug absorption. Food combined with drugs causing less or slower absorption. There's a section in your text on page 34 that gives you some common examples of some drug-food interactions. Drug-laboratory interactions. This is when you're looking at a person's labs, such as when I talked about albumin. If the albumin level is low and they don't have enough protein for the protein binding, so more of that drug will be free. The book gives an example of digoxin in potassium and magnesium. If the patient takes digoxin and serum potassium and serum magnesium levels are decreased, or serum calcium levels increased, digitalis toxicity may result. Drug-induced photosensitivity, which is interesting. I always thought of it as being that the person became more sensitive to light, but I've experienced myself because of the medication I'm on, and it's actually a skin reaction caused by exposure to sunlight. The people that are on a medication that says it makes them photosensitive, their chemicals in their skin actually have a chemical reaction to the ultraviolet light, so there's photoallergy, phototoxicity. Photoallergy occurs when a drug such as a sulfa drug undergoes activation in the skin by the light and causes this allergic-like reaction. You'll see them get a rash, a high sensitivity, or maybe even hives. But other medications, which I can take for myself, like methotrexate, they say you're a photosensitive and to avoid the sunlight and to actually put on very, very strong sunblocks. I am on methotrexate, and I went outside last summer because I'd been avoiding the sun because of the medication. I went out less than 10 minutes and I don't burn, normally do not burn, less than 10 minutes, and my skin became so raw and blistering from just about 10 minutes of whatever part of my skin was exposed. It was absolutely terrible, but it's a reaction of the chemicals in your skin due to that medication. Okay, drug interactions with over-the-counter. Lots and lots of people don't think of their medications or things they take over the counter. They don't think of them as taking drugs or medications. That is where nursing comes in. Very important role is to ask them to anything they take. Do you take anything over the counter? Do you take any vitamins? Do you take minerals? Do you get anything from a health food store? Do you take any herbs? I usually break it up and ask it in every which way I can to pull it out of them, because they don't think of reporting these things, and you'd be surprised what you might find. Over-the-counter things can be cold and cough medicines, there's sleep aids, weight control medicines, and it can cause all kinds of interactions. They are classified, as noted here, Category 1, safe and effective, Category 2, unsafe and ineffective, Category 3, insufficient data to judge. Some of the key things, like one of the examples your books gave, which is a really good example, is about aspirin. That people with aspirin should be aware that aspirin can trigger an acute asthma episode. And I don't know if you know about not giving any aspirin. I say under the 16 or under, if they have, especially if they have any flu-like symptoms. So I say just don't give it, because it's related to something called a Rice syndrome, which can be fatal. Aspirin, Tylenol, ibuprofen, acetaminophen are all broken down in the kidney, and if the kidney function is down, it can impair its breakdown and excretion. Also, it can affect the function of the kidneys and decrease them if they're on large doses over a long period of time. So I'm not always real comfortable with making so many things over the counter, because people will take larger doses than they should, especially with things like ibuprofen. They figure it's over the counter, so it's safe, and they don't have to worry about it, which is not true. And your text has an acronym in it for teaching. Stick here. Which I think is really good. Is safer, speak up, ask questions, find the facts, evaluate choices, and read the labels. Very, very important to read the labels. I had a patient that I was out, and so she saw one of the other providers, a physician. She was sick, had a cold, or had like a GI bug that she was treating herself. Came in for something because she broke out in, I know what it was, she broke out in a rash. He saw her, didn't think much of it. She came back, she was worse, and I forget what he gave her. She came back a third time. I saw her. I was reading through his notes, looking at this rash all over her. She was allergic to aspirin. Of course, I asked her, Dr. Wandis asked her about aspirin. Finally, I asked her, I said, I saw that you had this stomach bug. Is it all better? What are you taking? Did you take anything over the counter? And that's when she told me she took Pepto-Bismol. That's where read the labels, read the labels, read the labels. Pepto-Bismol has acetylsalicylic acid, which is aspirin in it. This whole rash this young woman was having for over a week, third visit in, was simply because she was taking over-the-counter Pepto-Bismol, unaware that it had acetylsalicylic acid in it, which she was allergic to, which was causing her rash. Let's see. Cough and cold medicines on page 38. It said not only does it cause a decreased delay in treatment, very, very careful with giving any cough and cold medicines to children, especially children under the age of 6. There should be writing on all of those medications now telling people not to give any kind of cough suppressant or over-the-counter medication like that to a child without being advised by a medical provider. You don't, certain things you don't want with the children. They can have reactions to things. They can absorb more. Benadryl is not always that safe for them. And cough medicines can suppress a cough that you may not want to suppress in a child because of the risk of pneumonia. Again, the end of the book. I love this textbook. At the end of each chapter, it goes over the nursing process again, patient-centered collaborative care, your assessment, nursing diagnosis, your planning, intervention, your teaching and evaluation. I think this is excellent practice. I would advise you to read through your nursing process at the end of every chapter, work your way through it, and have a good understanding of it. I have some case studies in here, NCLEX study questions. None of that ever hurts to do. Okay, so we're going to skip over chapter 5, the drugs of abuse, and we're going to go right to chapter 6, therapies. Okay. Plant or plant part used for its scent, flavor, therapeutic properties. I'm not going to read everything to you because I think you're capable of reading. Hear more and more about CAM, or complementary and alternative medicine. You see that word CAM used quite often. It's the Office of Alternative Medicine, developed by the Institute of Medicine to support studies with alternative therapies. I was glad when this started, so there's more and more information available, because people would often prefer, they try to think of it as being natural, not necessarily that it is, but a lot of people think that way. And if they'd like to use it, I'd like to know they're safe and have some guidelines to go on to help people decide what is safe, what isn't safe. Is it okay to take it? Is it interacting with things? So the Institute of Medicine has developed this organization so we can actually do some studies on it. A big problem with alternatives or herbs, over-the-counter type of things, they are not regulated, so you don't always know what you're getting in your medicine, and it makes it kind of scary because they only need a certain percentage, not very much, of what they claim to be, and you don't know what you're getting, and that can be a problem. So the recommendation, as noted on the slide, is the seal of approval awarded to products meeting criteria similar to the current good manufacturing practices. Sorry, could not remember what that stood for. So doing some kind of quality control on them. They do get some testing and things done on those products. Okay, so of course some herbs are much more common than others. So I simply targeted on the most common ones that's addressed by your book. I know everybody, I got a book by Kaplan, the NCLEX RN Drug Guide, which of course is prescription medications, maybe some over the counter, but it doesn't go into, when I flipped through it, I didn't see any herbs in it. So anyway, aloe vera, I'll let you know which ones I've seen. A lot of aloe vera I've seen used more from the plant, used externally, and it's in a lot of over-the-counter products externally. Internally is a problem, cause arrhythmias, neuropathies, edema. The time I'd worry about these is teaching like a parent, or if they have children in the house, if they have an aloe vera plant, or they keep aloe vera ointments or different things around, to the threat that aloe vera can be if taken internally, especially by a child. Black cohosh, I know that is used quite often, treats hot flashes, palpitations, irritability. You will see this used often by postmenopausal females. It actually can be very effective in the hot flashes. There were some studies done on that, and they did find that it had to do with the chemicals in the woman. It worked about 50% of the people, but the ones it worked on, it worked very well. This is where you have to look at potentiates effects of insulin and oral hypoglycemics. Because if you picture in our population of today, a female 55-65 often is metabolic syndrome, pre-diabetic, or type 2 diabetes. So you have to watch and ask about over-the-counter if they're taking something with black cohosh. Chamomile, relief of digestive complaints, may have sedative effects, rare allergic reaction. I know a few people that do take this, and most of them will drink it in a tea. And this is the thing here, if they're allergic to daisy or ragweed, they can have a bronchoconstriction. Dankai, I actually have not seen this. I'm surprised to see it as commonly used. All-purpose women's tonic contains vitamin B12. It doesn't say anything about potential bad effects. Echinacea, very common, stimulates immune system. It says limit use to 2 weeks. I've actually encouraged people to take this at the onset of a cold or things, but I tell them to take it for 1 week and then take a break from it, because the studies I've seen, it actually works for about 7 days and actually does a little boost to the system, and then really isn't that effective after day 7. Evening primrose, yes, I have seen that all over the counters and lots of patients that have taken it, preventing cirrhosis, eczema, PMS, hypertension, heart disease. It's the PMS that I've seen it the most for. I did have a couple patients that were taking it to lower their cholesterol, and actually it seemed to be effective for them, relieves pain and inflammation. So you can see where that might be attractive to some people. Feverfew, I have not seen this that often. This is a fear with this, interferes with platelet aggregation. So if your platelets are slippery, it may be a problem with taking it. It says people will take it for their migraines, and it also helps with nausea and vomiting that accompanies those migraines. Joint pain, some people take it with rheumatoid, but I don't know that it would really help with that. It might just help with generalized joint pain. But this is a concern here if it's somebody that's taking something over the counter that has this in it, or they're taking this herb because they've had a blood clot and not thinking about the fact they're actually on some other medication, or they're taking aspirin, something else that affects platelet aggregation. Garlic, that's fairly new. Detoxifies, increases immune function, again decreases platelet aggregation for hypercholesterolemia, mild hypertension. This, I've actually, a couple of years ago, I had a patient who started taking it, and it seemed to be working for him, so I don't know. He did not have any platelet issues. He and I had long discussions about taking N-type, NSAID, aspirin, anything else like that while he was on this garlic. Ginger, I have seen this used quite a bit, stimulates digestion, antispasmodic. Again, there's that decreased platelet aggregation, which has to be a concern, especially if they end up in the hospital emergency room or something. It's really good if they keep a list of everything they're on, medications on them, and which including all medications, any kind of herbs are over the counter. Ginkgo biloba. This is one that I've seen used quite often, and I think that you might want to make a note to know this one for your Kaplan review at the end of this semester. An antioxidant, peripheral vasodilator, increases blood flow to the central nervous system. Again, there's that decreased platelet aggregation. I've seen people take it for this increased blood flow to CNS. I've seen people taking it for because they have some peripheral neuropathy and they've got try to increase their memory. I don't know if it was working or not, but there's a platelet aggregation. Ginseng, again, very, very common. For stress relief, boosts energy, helps digestion, support immune system. It's these two things here, the boosting energy and immune system, that I've had people say they take it. Golden seal stimulates immune system and bile secretion. I know somebody that was taking it trying to prevent her gallbladders. Kava is another one that you might want to remember, that you might see on your Kaplan at the end of the semester. The biggie is that it may be hepatotoxic. Central nervous system sedation without loss of mental acuity or memory. So it may be good taking it near bedtime, but you have to be careful. Even though mental acuity is okay, you don't want your central nervous system sedated when you're operating machinery. But the hepatotoxic, do they drink any alcohol? Have they had a liver problem, or the other medicines that absorbed or metabolized through the liver? Licorice, anti-inflammatory, antibacterial, antiviral. I've really not seen licorice used. I do know black licorice, a while ago they discovered was very bad for hypertension. Milk thistle increases liver cell regeneration, slows cirrhosis, increased quality of life. I did hear that when I used to work with the midwife, and she was into a lot of these herbs. And that was one of the things she used to talk about, but I've not actually had experience with patients. Peppermint, yes, this one is great for this internal, stimulates appetite and aids in digestion. It's actually one of those things I suggest to some patients when they're having some digestive issues. It's a little bit of nausea, their gut is kind of sluggish, and have them take some peppermint. External relief of tension headaches when rubbed on the forehead. And there was a product several years ago that came out that actually had peppermint in it, and you rubbed it on your head, and I'm not sure what happened, but it did not last long in this country, but it was phenomenal. It took that headache away within 5 minutes. Okay, sage, used for sore throat and cough, limit use to 2 weeks, and that's not one I'm familiar with either. St. John's wort, that one has been around a long time. It's been well used, antidepressant, antiviral. For depression, anxiety, sleep disorder, effects in 4 to 8 weeks. That's the problem with St. John's wort. Even though that's the same amount of time that you're going to take for other things, some people don't like it. This is the problem here. Make his serotonin syndrome when taken with other antidepressants. So it's very, very important to ask people what they're on and advise them not to start this when they're starting on other medications. Saw palmetto. It decreases the size of the prostate. Actually, I have had some men take that. I'm not sure how effective it was, but it's one of those ones that's what it's supposed to do. And if they're going to have a PSA, the prostate surface antigen, looking for a problem with the prostate, a possible cancer, they need to discontinue the herb 1 to 2 weeks before the level, because it'll affect the accuracy of the test. Valerian, another very, very common. It's a mild sedative, sleep-inducing agent. They call it the herbal Valium. I have heard that, but it smells terrible. I don't know. I know one of my kids, before he was diagnosed as attention deficit, I used to give him Valerian when he was like 7 and 8 to help him sleep, and it did have a terrible, terrible smell. Okay. So we're back to the nursing process, again at the end of your chapter, starting on page 76. It has the patient-centered collaborative care, your assessment, diagnosis, planning, intervention, teaching, some cultural considerations, and your evaluation. Cultural considerations are extremely important to find out what is their normal practices. Patient teaching, patient teaching, patient teaching. teach for safety, teach about that there's no pre-marketing testing of safety and efficacy for these drugs. They are not standardized. They don't know exactly what they're getting. They can no longer make claims like they used to that it prevents or cures. So they usually say assists in treatment or may be used for or something like that. So they have to be very, very careful with what they're getting. Tips for herbal use. This is just a really good section. Got from your text, just abbreviated a little more for you. Do not take if pregnant. Do not take if nursing, breastfeeding. Do not give herbs to infants or young children. Do not take a large quantity of any herbal preparation. Don't delete seeking care from healthcare provider for persistent severe symptoms. Buy only products with contents and quantity listed on the label. The quantity is important because it can have the content and not tell you how much. Contact your healthcare provider before stopping a prescription medication. Should also call before starting something else. Store products in a cool, dry place. Dark glass containers are preferred. And that wasn't so bad, I think. We just got through the next 2 chapters.